In this video, we're discussing renal tubular acidosis or RTA and its effects on potassium levels. First, let's start with the basics. Renal tubular acidosis refers to a group of kidney disorders characterized by defective renal acid-base regulation. This defect results in metabolic acidosis, specifically normal iodide gap or hyperkalemic metabolic acidosis. There are several types of RTA, each with distinct mechanisms and clinical features. Before I start talking about types of RTA, I wanted to quickly orient you on this image. Here, you see the key players such as the proximal tubule, distal nephron, and collecting ducts. The proximal tubule is primarily responsible for bicarbonate reabsorption and is also a significant site of hydrogen ion secretion as part of the bicarbonate reabsorption process. The distal nephron and collecting ducts handle additional hydrogen ion secretion and fine-tune potassium balance through important pumps like hydrogen potassium ATPase, hydrogen ATPase, potassium channels, and sodium potassium ATPase. First, we have proximal RTA, also called type 2 RTA. In this disorder, there's impaired bicarbonate reabsorption in the proximal tubule, leading to bicarbonate wasting. However, the distal nephron can still acidify urine normally by secreting hydrogen ions. So urine pH is typically less than 5.5, but it may be above 6.5 in early phases when the body did not have enough time to compensate for the urinary bicarbonate loss. Proximal RTA can occur by itself or as part of a broader condition called Fanconi syndrome, characterized by loss of glucose, phosphate, amino acids, and bicarbonate in urine. In veterinary medicine, Fanconi syndrome is often seen in Basenji dogs or acquired from certain toxins and drugs. The second type is distal RTA or type 1 RTA. In distal RTA, the kidneys fail to acidify urine effectively due to defects in hydrogen secretion in the distal nephron. As a result, despite metabolic acidosis, urine remains inappropriately alkaline, typically greater than 6. Distal RTA can be genetic or acquired from various conditions such as immune-mediated processes or toxin exposure. Clinically, this form is associated with calcium phosphate kidney stones and nephrocalcinosis due to chronically alkaline urine. Type 3 RTA is a combination of type 2 and type 1 RTA affecting both proximal and distal renal tubules. Next is type 4 RTA or hyperkalemic RTA. This type results from aldosterone deficiency or resistance. Aldosterone normally increases sodium reabsorption via epithelial sodium channels in the collecting ducts. This sodium reabsorption creates a negative lumen potential, promoting potassium secretion via potassium channels such as ROMK or ROMK channels, and hydrogen secretion via proton pumps in intercalated cells. Aldosterone deficiency or resistance, as seen in type 4 RTA, reduces this process, leading to hyperkalemia due to potassium retention and metabolic acidosis due to reduced hydrogen secretion. Common veterinary examples include dogs with Addison's disease or those receiving certain medications affecting aldosterone, such as ACE inhibitors. Now, let's focus on potassium changes secondary to RTA. In proximal RTA, patients typically experience mild hypokalemia or decrease in serum potassium. However, serum potassium may be normal in certain patients. Here's how this happens. The increased amount of bicarbonate and sodium that are not reabsorbed early on in the proximal tubule move down to the distal nephron. This excessive sodium delivery stimulates sodium reabsorption through epithelial sodium channels, increasing the activity of sodium-potassium ATPase pumps on the basolateral membrane of the distal renal tubular cells. This active transport moves sodium into the interstitium and potassium into cells, increasing the driving force for potassium secretion into the urine via potassium channels, resulting in mild hypokalemia. In distal RTA, the kidneys fail to effectively acidify urine because of impaired hydrogen secretion in the distal nephron. Normally, sodium reabsorption by epithelial sodium channels in the principal cells generates a negative electrical potential in the tubular lumen. And this negative potential is balanced by secretion of hydrogen ions. However, in distal RTA, hydrogen secretion is compromised. So the negative potential is instead balanced primarily by increased potassium secretion through potassium channels, such as ROMC channels, leading to hypokalemia, or low serum potassium secondary to potassium loss. Despite systemic metabolic acidosis, urine remains inappropriately alkaline in this type of RTA.